Hello, everyone, and welcome to my presentation on infection control with an emphasis on improving hand hygiene adherence. My name is Monje Mupundu. Let's get started. So what is hand hygiene? Hand hygiene is defined as cleaning a person's hands with hand washing, antiseptic hand wash, antiseptic hand rub, or surgical antisepsis to reduce the number of flora on the hands. Thousands of patients die each year from hospital-acquired infections. These are mainly passed from healthcare workers to patients through direct patient contact, such as healthcare workers touching a patient's bedside commode without wearing gloves and then not using hand hygiene, and then caring for another patient after that. Hand hygiene is the most effective tool to use to prevent germ transmission between patients and healthcare workers. It protects the patient from contaminating infections, or from contracting infections rather, and helps prevent healthcare workers from taking home infectious diseases. It is also important to know which infection risks require hand washing or germ removal, such as C. diff, and which bacteria can be affected by hand washing and hand sanitizing. It is important to perform hand hygiene when walking onto the treatment floor, before entering a patient's room, before handling a patient's body fluids such as blood or urine. Gloves should also be used here. Before performing sterile or clean procedures, when leaving the treatment unit to go on a meal break, after every glove removal, after leaving the patient's room, after handling the patient's belongings such as the blankets or their bags, after being directly exposed to body fluids like needle sticks, and after using the restroom before returning to work. What is the correct hand washing procedure? Hand washing involves wetting your hands thoroughly with lukewarm water, applying enough soap to cover all the hand surfaces, rubbing your hands thoroughly together to ensure that the area underneath the nails, between the fingers, and around the wrists are properly scrubbed. This should be done for at least 20 seconds. And then rinsing your hands with lukewarm water, starting from the wrists and letting the water run all the way down to the fingertips. Using a clean paper towel to dry your hands, and then using another clean paper towel to turn off the faucet to avoid recontaminating your hands. The procedure for hand sanitizing is pretty simple. In order to properly sanitize your hands, apply a handful of hand sanitizer to the palm of your hand. Wrap the hands together thoroughly and ensure to cover all hand surfaces, including in between the fingers and under the nails, and then keep rubbing the hands together until they are completely dry. The key causes of non-adherence among healthcare workers include not enough time during a work shift to use hand hygiene as stated per protocol, not enough resources or inconveniently placed hand sanitizers and hand wash stations in the treatment unit, skin irritation from repeated cleansing of the hands, a lack of information about hand washing, or not enough visual reminders to perform hand hygiene. In my dialysis clinic, 2 audits were performed on 3 of the 6 randomly selected healthcare workers that work there, just to audit their hand hygiene practices. The graph shows the results of the audits combined. The columns show the number of successful attempts at hand hygiene when entering the treatment floor after glove removal, after touching the dialysis machines, after handling the patient's belongings, and before using the patient's dialysis access. The least adhered to hand hygiene practice was upon entering the treatment floor, with only 1 successful attempt between the 3 staff members. The most adhered to hand hygiene practice was before cannulating or connecting the patient's dialysis access to the machine, and it was successful on 6 attempts. Solutions to improve hand hygiene adherence include integrating new hand hygiene evidence-based information into practice by bringing it to the management's attention so that it can be potentially included in the facility's policy. Increasing trainings on the importance of hand hygiene, when to use it, and the correct techniques to achieve this. Placing hand hygiene reminders throughout the clinic to encourage staff to use hand hygiene. Ensuring hand sanitizers as well as hand soap varieties and hand lotions are available throughout the treatment area for increased adherence to hand hygiene and prevention of skin irritation. Encouraging better time management, task delegation where appropriate, and sharing job duties where possible to ensure there is enough time to adhere to hand hygiene policies. In order to maintain hand hygiene adherence, staff can pair up to remind each other when it is observed that necessary hand hygiene is not being performed. Staff need to ensure that supplies are stocked every morning so as not to run out of hand soap or hand sanitizers during their shift. Infection control leaders can be assigned among the staff that can spearhead hand hygiene initiatives, such as 2-minute educational talks or non-monetary incentives for the teammate that has the best hand hygiene for that week. Staff can also be assigned to perform audits on other staff members to help them realize which areas of hand hygiene need the most work, and in that they can be mindful of their own hand hygiene practices and know where to improve. Hand hygiene is very important. With these proposed solutions and ways to maintain hand hygiene adherence, patient care quality will improve, and there will be a decrease in the number of healthcare-associated infections, with less morbidity and mortality for patients. This has been my presentation. I hope you enjoyed it and learned something from it. Thank you.